We believe that improving the provider experience will ultimately lead to better outcomes and happier patients. Good morning, my name is Ian Madom. I'm an orthopedic spine surgeon and I'm also the co-founder and CEO of Mocingbird. So the inspiration of starting Mocingbird was to help improve the lives of clinicians. My co-founder, George Fernane, who's an interventional cardiologist, he and I got together and said, there's no tools for us to manage all of the non-clinical work that we have. And these continue to grow every year. There's no infrastructure to help us get things done that have nothing really to do with taking care of the patient. So we want to have those things run in the background so that we can get back to doing the things that matter most to us. Mocingbird is a software as a service platform for both clinicians and administrators. We deliver a rules engine that manages all of the clinicians' credentials and matches up the education that they need so they're getting the right education at the right place at the right time. We're essentially a compliance platform, but we want to move beyond that. And our motivation here is to change continuing education from a box-checking activity to something that's more impactful, something that actually improves the performance of clinicians and ultimately improves patient outcomes. Mocingbird is out getting people on the platform, right? So we are currently out in the market. We have had a lot of success in the digital health space. This seems to be where the need is most acute right now. In a post-pandemic world, with the growth of digital health, with the growth of telemedicine services, more healthcare providers are obtaining multiple state licenses. They have multiple credentials already. Now those requirements are becoming so onerous and so overwhelming to them, they need some type of platform that manages it. Not only that, the rules keep changing all the time. So there's really no way for somebody who spends their day taking care of patients to then carve out time to figure out what they actually need to do to continue to take care of patients. So we have been really pursuing the digital health space. We are starting to move more into that education space where we can deliver education that's more impactful to people. What do people really want to learn? Not just checking a box of the education I have to do, but what are the things I want to do? And ultimately, what are the things I don't even realize I need to know, and delivering them that education before they even realize they need it. Our plans right now are to scale the platform primarily in that credential compliance space, but then build education tools that lay on top of that platform to deliver it directly to clinicians. You know, we are focusing on the healthcare professionals' experience working, right? There are, rightly so, lots of platforms out in the marketplace right now that are trying to improve healthcare for the patient. We believe that improving the provider experience will ultimately lead to better outcomes and happier patients. So our focus is the professional, is the provider. And that goes from everything on how we deliver the platform, the UI, UX, to the content that we deliver. We don't create content, but we filter it to really meet the needs of our users, and we're so intimately in touch with them that we feel that we can do the best job at that. One story that's particularly important to me in our journey to express is the resistance that we're meeting sometimes from the organizations that continue to say, this is the clinician's problem. This is the healthcare provider's problem. That doesn't sit well with me, that doesn't resonate, it doesn't fit with what we're seeing in the media talking about the Great Resignation. It also doesn't fit with the ultimate goal of those organizations, which is to deliver great care. we want to row in the same direction, but we're currently not. So it has been on more than one occasion, and one in particular that I have in mind, where we have been told this is the doctor's problem. This is not our problem. And to me, that falls very flat these days. So when we do deliver the platform and we are working with organizations that do believe in what we're trying to deliver to clinicians, they come back and say, we don't know how we did this process without Mockingbird, because it makes things so easy and efficient for us. And ultimately that's the goal, right? Is to change the efficiency of the continuing education space so that we're bringing more value, we're changing what people actually expect out of it, which is to get better at their jobs. COVID has changed the continuing education space to bring digital education a little bit increase in popularity. I believe now that things are starting to open up a little bit more, people do want to start getting back to those live events, and we're working with continuing education providers to offer that to our users, but people still want a digital experience. But even more than that, people are starting to realize me sitting on a 30-minute, 1-hour webinar is not very efficient. Why can't I get the right education in 5-minute snippets? Why can't I do this while I'm seeing patients during the day, getting the education that I need in real time? And the tools just don't exist to do that. We are basically delivering in United States healthcare continuing education that was developed 30 years ago to meet the needs of a healthcare system that was 30 years ago. We are not doing anything different in 2022, and that doesn't make much sense, does it?